So welcome everyone from the Office of Community Engagement. We have Diane and Juan on with us, and we're so happy to have our guests and our presenters. We're going to present an exemplar of community engagement during COVID-19, and we'll kind of tell you the story of what we did and hopefully how we go forward. Next slide, please. The purpose of this presentation is to present an exemplar of community engagement during the COVID-19 pandemic. The specific objectives are one, to describe the Preparing Baldy Community Engagement Project. The second one is to identify community partnerships and collaboration using faculty, student, institutional, and community strengths. And the third is to review the challenges to community engagement and create goals for moving forward to address emergency preparedness and equity. Next slide, please. Our presenters include myself, Dr. Teresa Dodd-Butera. I am Professor Emeritus at CSUSB and in nursing. I'm also Associate Dean for Research and Professor of Public Health and Doctoral Programs at Azusa Pacific University. And I am FERPing and functioning as a faculty associate for the Office of Community Engagement. I'll let Stacy and Alessandra tell you a little bit about themselves. Stacy.
I'm muted, sorry. I'm Stacy Shipway, and I'm a recent D&P graduate from Azusa Pacific. I'm a registered nurse, and I'm also a graduate of CSUSB and my master's for nursing.
And I'm Alessandra Felix. I'm also a recent graduate, and I graduated from CSUSB with my bachelor's and then as well with my master's.
So right here, we're starting off sort of showing this collaboration and partnership we have between universities, between students, and we have between disciplines. So next slide, please. So the Preparing Baldy Community Engagement Project started as a collaboration with, first, as Stacy said, she was a Doctor of Nursing Practice student. She was an alum of CSUSB, but was getting her doctoral degree at Azusa Pacific. In my role with the Office of Community Engagement, Diane Podolsky, our director, identified a student who had reached out to her who was looking for a project in the community. She was particularly interested in perhaps working with young people or schools and families. And so this is how the project grew out of it that they're going to describe, but it also leads us forward with, we encourage people who are listening, if you have a student, if you have an idea, please bring it forth, and we'll talk a little bit about doing that going forward to the Office of Community Engagement. We want to hear about community needs and student and faculty interest. Next slide, please. So I'm going to let Dr. Stacy Shipway take it over from here.
Thank you so much. So the community of Mount Baldy lies just above Claremont and Upland. It's a rural community within the San Gabriel Mountains. It lies just west of the San Andreas Fault. It has an estimated population of 149 with 68 households. The thing is, they have a lot of hikers. It's a very well-known hiking area up to the peak of Baldy. So they have all this surge of increased population, especially on the weekends, up there hiking. There's biking. They do have a ski lift. Some of the problems with the community as far as emergency preparedness lie in the communication and the fact that the whole community lies right on the county line between LA County and San Bernardino County. So you have multiple agencies, including forestry, because it's national forest, within 2 counties. So you have CHP in 2 counties, you have sheriff in 2 counties, and all of these people must collaborate for any kind of a drill or any kind of exercise, or in the event of emergency such as a fire. They have a one-way road, 2-lane road in and out. There's a secondary road, Glendora Ridge Road, but it's been closed almost 100% of the time that I've been up there, which is frequent. They have had multiple forest fires in 2020, if you remember, up in the community. It's a rugged terrain. They've got tunnels. The 2-lane road is up and back. There's no facilities up there in the community. They do have an elementary school up in that community. They actually bus students from down the mountain up into that community to experience the lovely outdoor classrooms that they offer. And they're also an elderly population that I found out. 60% of the Baldy residents are over 60. I think they've retired up there and enjoy it. Next slide, please. This just shows a map of the area. There's a little village area that has most of the residents. But then if you continue up the road further north, up the switchbacks, there's another area of community up by the ski lift. There's actually a monastery, a Zen monastery up there with quite a few residents. And then below the village, which I consider below the tunnels, is also another community, Barrett Stoddard, that also has some little village peoples that are also in the National Forest. Thank you. Next slide. The problem that I found, for one thing, I decided to do Mount Baldy as emergency preparedness because I grew up in Claremont. I live in Claremont. I'm up there hiking all the time. And every time I'm up there as a nurse, I keep thinking, we've got some at-risk things. I don't know if I could get myself off the mountain in the event of a fire. And I know the trails in the area well. So what we began to assess, we did a needs assessment, or I did a needs assessment up there and determined and looked at the SWOT analysis. They had done one in 2016. So we compared current concerns of the community. I talked to forestry volunteers. I talked to the fire department at length, sheriffs. I talked to the residents, the community leaders, the school superintendent. And some of their concerns were that, again, the communication when they have an evacuation or a problem, because it has multiple counties, is a concern. They also voiced the road as a concern. And this picture down below is the Glendora Ridge Mountain Road. On the many times I was up there, closed again. So that's not helpful. I suppose the fire department could open it up, but that doesn't help me get off the mountain. I would have to go down the regular road. And then community action plan was initiated in 2016. Some of the other concerns that the community had were their communication. Since you've got these 3 geographical areas, there's no cell tower up there. They have voted that down. They do not want it up there. And so limited cell coverage for them to communicate, or even communicate with each other that they have somebody in need up above the switchbacks by the ski lift is a problem that they are concerned about. Next slide, please. We utilized the Sendai framework, which was established in 2015 by the United Nations to guide the efforts of disaster risk reduction and set some common standards. The first priority would be understanding the risk. So I needed to assess the Baldy residents and find out how their risk assessment was. Did they find themselves concerned, and did they realize they are an at-risk population? The second priority is strengthening the governance. Baldy is a developing community partnership through community events. They do reach out and have community events in the area. So we need to maybe look at that and strengthen some of those community resources, especially San Bernardino County, where's the county, the village, and most of the residents lie within. The third priority would to address the risk reduction through public and private investment and look at private grants and funding for the fire department. It's all volunteer up there. There's over a 12-minute response from the first full-time fire department that could respond up there. So the volunteer fire department is very active up there and very needed. And so channeling some funding that way would be very helpful to them. And the fourth priority that the Sendai framework looks at is to enhance preparedness for individuals, families, and systems through education. And that's kind of where I concentrated my project on. Next slide, please. So the program implementation, initially I looked at the stakeholders, determined the needs assessment. I utilized the vision, mission, objective strategy, the VMOSA, and to prepare Baldy. The vision of preparing Baldy was preparing Baldy. The mission statement is to promote community readiness through education strategies for empowering individuals and families. And the overall objective of the project is to create conditions to healthy, resilient community. Next slide, please. When I began to implement the project, again, I got stakeholder approval. They actually have a town hall meeting called the San Antonio Town Hall Meeting that they have representatives from each geographical area. They had CHP and sheriffs there, and they talk about through some of their problems. And I attended some of those and discussed some of their needs with them as well as forestry, and looked at, again, the SWOT analysis. Their strengths included the fire department and the fact that they're a very close-knit community. They do rely on each other because I think they have to. Weaknesses, again, the multi-agency jurisdictions, lack of plans for the visitors, water system that was fragile. They truck in water to some water containers that are up there, and then it's fed by gravity. And that's been proven to be a little bit unreliable. Lack of shelter in place supplies. The school has pretty good supplies, but not for the greater community. And I looked at some windshield survey stuff. So opportunities, perhaps some grants for the fire department, organized community leaders to do some drills, and then the threats or the visitors and the overcrowded trails especially became overcrowded during COVID. Next slide, please. So initially, when I began to implement this project, I had an initial survey to assess the resident risk perception, their preparation currently, and their commitment to an action to maintain their kits and to look and add things. This was administered by the community leader, Ms. Sulkin, and it went out via email to the people of the town hall meeting and the leaders. And then I had an educational Zoom kind of targeting some of those areas, looking at some of the things that were of concern. We looked at educating preparedness and whether they were prepared and their risk assessment and things like that. And then a second survey was originally designed to send it out to see if they had gained any knowledge, to see if they had become more prepared. The problem was, despite any discussion, that went out on social media to a completely different population. There was some overlap, and I had included a question that included whether they had taken the first survey and whether they had attended the Zoom, but essentially it was almost an entirely different population except for about 3 individuals. So, or no, 8 individuals, excuse me. So that became one of the problems I could see right away, that the communication was a little bit confusing for them. Next slide, please. One of the things on the second survey that we put in there was, will you maintain your emergency preparedness kit? And will you tell one other member of the community? And will you become more prepared and let them know what you're doing? And whether you did or didn't do that. So this is a Tell One model designed by Dr. Butera about individuals, communities, and systems, and their interventions, education, preparedness toolkit in this case, and the stakeholder review, and then whether or not they told one or not. The idea is to tell an individual, tell another community, tell another student at the school, so that it disseminates throughout the community and the whole area becomes more prepared as a result. Thank you. Next slide. So some of the lessons we learned were the project and community barriers. The pandemic had a large impact on my ability to get up there. I would certainly include that in some of the communication that occurred, because if I'd been out there and administering the survey in person, that probably would not have occurred, but it allowed some identification of some problems when they're unable to meet in person or when they're unable due to snow to get to each other. Of course, we know that technology has been a problem, and we had some learning curve to learn initially for the community and their communication system. Some of the facilitators were the town hall meetings. They were very active and engaged. The Baldy fire chief was overwhelmingly supportive and happy to do whatever we wanted to do, and happy to help the community become more prepared. And the school superintendent also very positive and very involved. The close community connections were also a benefit. Thank you. Next slide. I'll turn it over to Alessandra for this part of the collaboration.
Thank you. Yeah, so like Dr. Dodd-Butera had mentioned, I was connected to Dr. Shipway for this opportunity to collaborate. And initially, I was sort of learning what Dr. Shipway was learning through her needs assessment and what she told me about the community. And she had the opportunity to visit. So it was really cool to get to hear her perspective and kind of figure out a way that we could support this community and do what we can do. You know, I guess like I can't think of the word, but to promote the Sunday framework and just, you know, get universal emergency preparedness and readiness, especially at a time like now and during 2020 and 2021 when things like the pandemic were so relevant and isolation in general, especially with like a vulnerable community that's even more susceptible to isolation and being remote. So there were a variety of challenges and opportunities with this community that I initially learned about and was really excited to see what I could do. Next slide, please. So to start, I conducted a literature review and I was just searching for evidence-based tactics and methods that we could use to sort of help this community. And I did see that the Sunday framework actually called for the integration and utilization of children as agents and teachers and activists in change and emergency preparedness and preparing their community. So we had the idea of creating a resource kit that would be comprehensive, and it grew to be more and more comprehensive as the project grew because we realized of like all of the opportunity to include so many different ages and populations within. But so we knew that children could be utilized as agents of change, and public schools serve as that sort of institution level to connect community members with the systems and government level. So I thought the resource kit could be disseminated at public schools and through the one public school in Mount Baldy. And I made that resource kit really specific to the community. So it has information about risks specific to that region. And that was relevant because each community has different risks and has different needs. So it was cool to sort of explore that from Mount Baldy and how that differed from other places. And then creating the resource kit that was totally inclusive and totally comprehensive included creating different like sections for different age groups, because different age groups are at different developmental stages in life, and different things sort of work for different children and people in general with learning, memorizing, and just even understanding disasters, especially with youth. Something that was emphasized was not scaring them and sort of approaching it in a feasible and digestible way, that they can get this information about something scary or something traumatic and feel like they have the power to know what to do, even if they are young and, you know, their family or people older than them aren't as educated or prepared. So in sort of doing the literature review, I was learning about different things we could do in that respect, and putting it together. I included a lot of different activities and a lot of different ways that you could learn, including videos, music, if you like drawing, if you like reading, different things like that to really engage community members and specifically youth, so that they could be encouraged to learn something and share it with others. The kit became even more inclusive as we made it totally virtual, because during the pandemic, that was one of the only ways we thought we could get it out to people. And it also has a document translator. So if you speak Spanish, you can actually use that for anything within that and anything else you find online. And there's a lot of links and resources. And we also, over the weeks of working with Dr. Dodd-Butera and Dr. Shipway, we discussed including populations like special needs, because your response to emergencies is much different if you're a special needs child as to if you're not. We also included like elderly population, you know, if you have a grandparent in the household or something like that, because Mount Baldy had a high elderly population. We also included pregnant mothers because there could just be so many varieties of people that are in a different situation, and really gearing the community to be able to assess any situation and help all members, included making it that comprehensive. So I got to delve into it a lot, and I got to put a lot into it and find so many different resources and different ways that, you know, were unique to people and things that they could do. And it really felt like there was a huge emphasis on putting the like resources and things that already existed into community members' hands. And I think like closing that gap and bridging that gap, this resource kit was a really cool way to, give all of these resources to community members. And it, again, making it digestible was tough, but it made it more like interesting and fun because it, seems like something you want to read and you want to learn about and you want to share with others. So it was really cool to sort of, use the challenges with this specific community and like create something so unique. So I'm really hoping that people get to use it and get to, it's, despite the fact that it is tailored to Mount Baldy, it's really relevant for all communities. So I think once, we get to sort of share it with others, I think it could be relevant in so many ways. And like I said, it includes so many different communities. So it was really awesome to get to work with the both of you on the resource kit, and I'm excited to see what's going to continue to happen with it.
Excellent. Next slide, please. Thank you so much, Alessandra. We enjoyed it as well. So continued program implementation and sustainability. The toolkit can be continued. I gave it to both the community town hall meeting and to the superintendent of schools. So wherever any of them go, they can take that with it. It was shared with the greater community. Whether they have families or whatever, they can use it or utilize it in the ways that the community sees fit. And then I presented all of this to the stakeholders meeting in the fall. What we are recommending is that the individuals follow up with individual levels of sustainability, keep their kits updated, help individuals review their preparedness kits and update them. Community sharing preparedness information like the toolkit among other communities. And then the system is continue systems level planning for community readiness and look at communication methods. And we can look at the water system. I don't know that I have a solution for that exactly. Next slide, please. So post-COVID sustainability, what I would like to do, first of all, it's very evident to all of us that disasters now are happening in multitude, one on top of the other. You have a pandemic on top of an evacuation need. And what does that mean to us now? How do we prepare for that? We have to prepare for a variety of things. And when we have to leave our home, we have to be ready for a pandemic or ready for whatever war or whatever is coming our way. It's a scary thing to think about, but being prepared, like Alessandra talked about, definitely lessens the anxiety for all of us. What I'd like to see is have some more community fairs, some drills up there with the EMS system. They have an annual barbecue and pancake breakfast that's attended by the whole community when we're able to have that. And so I'd like to have some flyers and a booth up there for emergency preparedness. Just a reminder, they have biking events, flyers at the leadership level in the town hall meetings once they begin to meet in person, which they haven't done that yet. Partner with the school, classrooms distribution. They are back in class up there. So that's a thing. But again, we're now already in fire season. So, we'll just have to see how that pans out. Individual families and visitor education with flyers and bulletin boards. I was just up there last weekend and I found the visitor center from Forestry is open for the first time since spring of 2020. First time I've seen it open at all. There was tons of kids. The community was active. The little restaurant was open and people were biking around and hiking, and it looked like the old Baldy I used to know. So we can get up there now a little bit, some flyers at the visitor center where the volunteer rangers are would be really helpful, and remind people to tell somebody where you're hiking and to be prepared in the event you have to evacuate off the mountain, even when you're hiking. Thank you. I think that's it. You can, yeah, there you go.
I think there's one more slide of references.
Thank you.
And so the meeting is being recorded. So if people want to go back and revisit what our references were, they can do that, or really any piece of this. So it really has been a privilege to work with Stacy and Alessandra. They just were very committed to the community needs. I think there's a couple of things that, you know, both good and bad, I guess, that we learned from it. So that idea of the initial assessment was really critical for us to understand it, that we didn't take the community engagement piece upon ourselves and say, we know what you need. I think that idea, first of all, that was before COVID. So right, Stacy, you were able to go to the visitors center and to connect with people. Now, this also, that idea of establishing those relationships ahead of time made it more seamless. And I think that's a lesson from all of this, our continued community engagement at whatever is going on, so that even when we have challenges, you know, we can make it work. We have established those personal relationships. We have respected what the community says they need. And I think Alessandra's really just, it was just such a beautiful, it's almost like a living document, I think I'd call it, Alessandra, because you started with a focus on what that community needed for the, you know, for the school itself, based on what we learned from, if they got stuck up there, you know, what would they need? And then the idea of tell one. And so I do want to emphasize that this is really about community empowerment and equity, that it's not just about somebody swooping in and we're going to fix everything. It's about giving the information to the community and then helping them to build by telling another person. And then like what Alessandra did, that idea of, well, we'll start with what the school needs, but then we'll think about what is the school community that includes families across the life course. And so, and that it can be added to and changed and whatnot. So I think that was some really valuable things in reflecting on this. I think the other thing going forward, Stacy, that we have identified is this idea of communication and concerns about water. Maybe you can speak to kind of what did the leadership say, if anything, that maybe at their next fall meeting, you know, how they might address those things.
Well, it's interesting because a rural community like this, I think they live there because they like the isolation. But then you have an element of the community that understands that they're at risk and that the communication is a huge problem. It just hasn't disseminated through all the community. For example, they have the Zen monastery at the top of the mountain. They haven't wanted previously to be any part of any communication system, yet they have, you know, they have a lot of people living there. But now they've kind of changed over to a new generation, and they actually attended the barbecue this summer. So we're seeing a little bit more, maybe they're realizing that they need the community and should be reaching out. And I hope with just continued education and continued presence and talking about it offers some hope and help that perhaps they need a little bit better system and can eventually get a cell tower. That would be, I would think, the first step, you know, and then water would be good too.
And so it's basically the hikers, for example, do they go up with just plastic water bottles or?
Yeah, just their water bottles that they, and there's not even a spigot really in the visitor center to refill, because the visitor center has been completely fenced off. So there's not really a place for them to refill. Like you go to a national park and you know you can get a refill of your water bottle, but there isn't that resource unless you absolutely know and live up there where you could find it. So, you know, that's a risk too for the hikers. I think, you know, there's some nice forestry bulletin boards that I'd really like to post and educate the hikers that, you know, it's beautiful up here, but you need to be, this is the forest, you need to be prepared and have your water because it's a long way down the mountain.
So I think that the two things maybe going forward in terms of for Stacy, and then I have some questions for Alessandra, that idea of, you know, if you have to shelter in place, right? Like if you get stuck somewhere, having those things, you know, to cover yourself if there's a fire or, you know, water supply, these things are you need it for 3 days. And I know hikers are notoriously like, carry the lightest thing possible on your back, right? You don't want a lot. So, and that there's even, when times are good, you don't have a lot of stores or, there is one little restaurant, but in terms of people just going and saying, okay, I want to buy some more water or something, that it's really not available. So I think going forward that identifying water sources for both residents and hikers, if they get stuck there, if you have to shelter in place, how do you do that, and survive?
Mhm.
And then the idea of, and then how do you evacuate if you need to? And then there's that communication piece too, right? That if you're sending out your normal level of communication, you have multiple different mechanisms for doing that, but they're not reaching necessarily the same people. And I think you identified that. So that I'm hoping, if you follow up with some meetings that you and Alessandra and I could maybe go to, if they'll allow us to do that, maybe to talk with them without, again, just mentioning these are some things identified that they are the drivers and make their choices of what they want to do with it. And the other piece that I was thinking for Alessandra is with the monastery, for example, maybe creating, I'm going to call it a culturally sensitive kind of toolkit for them, that, what do they need? There might be things that are important to them to preserve, right? If they have to shelter in place or if they have to leave, how they would do that. If they evacuate, what are their needs to communicate? Maybe they write down there's a certain amount of speech or there's a certain amount of interaction with people. I'm not sure, I'm not real familiar with it, but that they would have that recorded and that you tell them, prepare for that, so that people can be culturally sensitive in that way. Any thoughts for you, Alessandra, about, anything else you might add or from what you've learned from them?
I just really like that you highlighted like just the, communication and how like crucial both community members' participation and, stakeholders and policymakers and whoever play in this. And also that it's really, really crucial for us to be like meeting these community members and knowing what their needs are from their lens and their perspective, and us not telling them. So I really appreciate, that this project has helped us learn that and, be able to like emphasize that. And I think that would just be the next best step in, approaching any community, and especially this one with such specific needs. And I, again, like that those sort of challenges like offer so many opportunities. So I'm, looking forward to like utilizing what I've learned in creating this kit with other populations as well.
Thank you. I also really want to take note that Alessandra, there's an ability that for what she did to translate it to Spanish. But as we know, right, in California, there's so many different languages that something like this could be helpful to. And so I think that's another thing to think about. Because Alessandra did not just take and make stuff up. She actually created a resource kit that was like stuff that was already out there. Hey, let me organize it for you. So I think that that is also an advantage to people because, you might be able to find something already translated for you and in multiple languages. And I think that's another vulnerability when you're talking about giving instructions to people. It's very frightening to be in an emergency, when you have all your faculties and when you are able to understand things. But then to add this level of, really, really scary for people to not understand directions, what's going on, and I don't understand this. And so facilitating that in whatever language, but also, we're going to move into some of the other projects, how this grew out of, so I'll move on to that, but I want to just make sure, ask if anybody else has anything to add before we kind of put this in context of what all this has to do with maybe the connections from community engagement, what we've been working on for a few years. So anybody have any other comments or anything before we move to that, or any questions?
Yeah, I have a question. I also live in a kind of rural mountainous community, kind of in Crestline, Lake Arrowhead area. I'm wondering why there's not a want to have a cell tower up there, and how people communicate. Is it through a landline? Is it through internet? This just kind of boggles my mind, because we have a Facebook group where that's kind of our metaphorical town square, where, you know, if there's a fire close to the lake, you can make sure that you're going to get a notification from the local Facebook group. So just interested in why they chose not to have a cell tower.
Right. Well, I think again, there a lot of it doesn't. The village is really the only incorporated area that actually has owned property. The rest of them are in forestry, and they're forestry cabins that have a lot of limitations just by virtue of, you know, you can't build just anything there. So I think that's how it kind of started, and the people that were attracted to that community kind of, you know, I mean, they're hiking in with their groceries. It's not exactly like they're driving in for a lot of them. But they do have a Facebook site that they do communicate with. So those who are in the village and those who are up on, you know, on the Wi-Fi and have satellite are able to communicate. But, you know, that doesn't include everybody up there, because a lot of people up there like the remoteness. It's just that they're out of the loop completely, as you know, about the road and rocks in the road or any kind of hazards. They're all on the Facebook site. So, yeah, why? I don't know.
Yeah, I grew very dependent of my Facebook group with everything that you mentioned, with road conditions, with, you know, local fires. So I just see that importance, you know, different communities, so they have their different needs, but I thought that was super interesting.
And maybe it's an older community, you know, a lot of the people up there. But again, the people who answered the survey were those that had Wi-Fi. So, you know, I mean, I probably didn't get a lot of the, you know, the whole picture really.
Yep, thank you.
I had two questions, if you don't mind. The first question was, I was walking, so I couldn't see your slides, but I was wondering if the community engagement packet with information that you put together was very Baldy specific, or is that something that you could or maybe plan to spread across other communities?
Yeah, I think at the moment it's a little Baldy specific because it does have information like on, mudslides or, wildfires and maybe things that people living in the city don't necessarily deal with as much. But I think in general, it has so many links to websites or other resource kits, even in other forums where you can sort of find so many things. It's so inclusive that I think despite the fact that maybe it's not perfect, it could definitely be used in other communities without any tweaking.
Oh, wonderful. That's so cool.
We're really hoping that we are creating these models of that idea of here's resources that we're organizing, because I think what we found in the context of years of our research, not just with Baldy, but with the Wiley Center, with families with special needs, CDC and FEMA and World Health Organization, the Sendai framework have wonderful resources. They've done a wonderful job, but in terms of connecting to your average person, right? They don't charge people for going on, but it's, I think, having the Wi-Fi, right? Having an ability to understand how to navigate these sites. If you've never been on the CDC site, oh my gosh, it's so fabulous. There's so much information, but you wouldn't know where to start. And so that's the piece of this, that we can create this model that allows people, that we can get them started with these templates. But that idea is not just you who are open to getting this information. It's the idea of, we really want you to share it. And that tell one, this is how we get communities to be mobilized and to be strong. And also that we have equitable dissemination of information to people. And for people to just say, yeah, it's out there. That's available, accessible, understandable in different languages, understanding who your neighbors are and how you get that. And I think that's really important. I'm going to let you do your other, you said there was another question, and then we'll talk about the context of how this all came about.
Yeah. So my dissertation was on the use of Facebook groups as a community organizing site after wildfires. And so I was just curious if you had involved those Facebook groups in your efforts. Like, did you have a public presence in those groups, or what was your relationship like with them?
Yeah, I'm a member of the group, and that's where the second survey went out, which was not my intention because that's a greater group, and I was kind of targeting the leadership from the first survey. So that was one of the problems. Okay, well, we went out to a greater group, which is okay because I reached more people that way. But you know, my presence is kind of as an observer. I'm not you know, contributing that much, but the toolkit went up and a lot of the information is up there. It just you know, you don't know where it ended up or who looked at it, you know, so.
Yeah, okay, cool. Thank you so much.
Bailey, I think this is, we've identified another person that we need to get involved in our little network here, because that's a very cool thing to use, you know, Facebook. And so I think we're wanting also to involve both campuses. This idea of reaching people is about, here's the information available, accessible, empower communities. So I'm going to go back in time a little bit and then talk about how much we owe to the Office of Community Engagement for these beautiful projects that they make possible. Really the connection between, and I see our chair for the nursing department has joined us. Hi, Dr. Burch. So we've had a really good relationship with the Office of Community Engagement. It's, you know, starting back to those seed grants that they give to get us started with maternal mental health, you know, with the Wiley Center. And then, so what we kind of grew into was working with, you know, APU, CSUSB. There is a Randall Lewis Health Policy Fellowship. We've got the Wiley Center. We've got the Inland Empire Disabilities Collaborative. We now have the Mount Baldy, you know, Association. We have all these groups that are working together about empowerment and equity around emergency preparedness, but there's all these social determinants of health that are involved in this equity and empowerment for this. And the people who have the least do the worst. We know that there's lots of evidence to show that. And we've seen that in the pandemic, and we've seen that in just other things. And so that idea of creating this model, we've now created a network in Southern California, piece by piece by piece, that we now look at families with children with special healthcare needs. We took some of that grant money and we got a generator for the Wiley Center, in addition to emergency packs, in addition to doing needs assessments there, and kind of found out, hey, you know what? If these families get evacuated, they do not want to go to a high school gym. Please, let's set up a facility that is sensitive to people with autism spectrum disorders, for example, that's not overstimulating and re-traumatizing them, in addition to the how upset people are with the emergency occurring. It's then being evacuated to a place. So then we kind of have set up that idea of a model of specific to what your community needs, not equality where everybody gets the same, but equity where everybody gets what they need. And so being able to look at each community and see what their needs are in assessment, working with the stakeholders, creating that, and really it was the connection with the Office of Community Engagement. So thanks to Diane and Juan for all they do, that idea of connecting, you know, Alessandra, I think you came to Diane and she said, you know, we've got a student who's interested in this, and what can we do? I want to mention another idea that I actually forwarded to you, Diane, when I met at PDC. The director for the Osher Center was talking about the community of, you know, older citizens who have been hit really badly by COVID, you know, sometimes can have a little challenges with technology skills, and creating perhaps an engagement project where we have an intergenerational thing, where we have a student who wants to teach or disseminate information about technology so that older populations don't feel disconnected, because this project would not have been possible without the use of technology. I mean, we couldn't have disseminated it. Stacy couldn't have attended the meetings. We couldn't be having this meeting, right? That idea of the use of these things as really important that I think, we get to do pretty easily. I'm saying that kind of tongue in cheek because we've all had issues with technology, but it's a little more accessible to us, right? When we have the structure of the university versus somebody who doesn't have that connection or with a community group. So, I think that's going forward. Those are some of the ideas that we've had when I went to the PDC meeting that came to me, that idea of please keep up emergency preparedness. The nursing department has come to a couple of our other meetings, and they have a public health, a clinical for students. This is an incredible opportunity for service learning, for community-based participatory research. We have, more MPH projects. I think the person who was in charge of the, and I don't want to miss naming them. Alessandra, can you tell us the faculty who worked with us from that department also? They were very supportive of this too. And I don't want to be remiss not mentioning them.
Dr. Michigini.
And who's that? You had two though, didn't you have one who was
Yes.
your?
And then Dr. Harding as well was my reader, and she played a huge role as well. And even Diane, thank you for bringing her up and, honoring that she connected us as well. There were a lot of people that were involved in getting us to work together and played a role in, everything I did. So.
And so they brought up, hey, there's more students looking for projects. There's more faculty looking to connect people. And we are both San Bernardino and Palm Desert, all of Southern California, and I guess our nation and our world now we are in need of a lot of things. So I think this is just an example. I think it's an exemplar is what we said in terms of how to connect the community, of ideas of what we can go forward and hopefully grow forward on it. And Regina, I see that your camera is on. Can you tell us, if you have any questions or comments about this?
Absolutely. My name is Regina Uday. I'm a professor in the health science department, and I'm also the internship coordinator for the undergraduate students. And so we're always looking for opportunities where the students can engage with the community. And so one of the things I was really excited about trying to find out today is what are some of the projects that the students can work on, who would I need to contact? Because part of our program requirements are that they have to engage in some type of hands-on experience. And I think getting involved with some type of community partner would be an excellent opportunity for them to gain that experience. And so I'm just really excited about what I can gain from this, and as well as having that connection, that collaboration with you guys to find out how we can better get our students out there, making those assessments, making those connections, bringing that academic work that we provide for them more closer to home, because they're out there in the communities doing that assessment, doing those engagements, working with those stakeholders and those community partners. I just think it's just really such a worthwhile opportunity. So I really have been thrilled about what I've heard from you guys today, and I'm excited about possibilities. So thank you.
That's great. Thanks for joining us. I'm wondering, Diane, if you can address some of how you've connected people. I think this has just been really important, how to go forward.
Sure. I think that it is many hands make light work, and I definitely want to utilize all of the resources that we have at the university to help with community partners and using the community assets to address these needs. And I think that one thing that we've always tried to do is to be flexible, because as we know, needs emerge, relationships take time, and the assets of the community are constantly changing as well. And so we always want to approach this with the idea that we are here to learn with community, and we're here to work with community. And I think that has been the key to this whole project being successful. And congratulations to all of you. I'm very impressed again at all the inroads you made. I know that there was a lot of time spent on relationship building. I know how important that is. Yeah. And I'm hoping we'll be able to maintain some relationships and get some new people involved.
So hopefully the undergraduate and the graduate program in health sciences can, identify students' interest in things. And I think it's been, like Diane was saying, very flexible. Like, hey, we've got this over here, right? We've got a student who wants this. We've got a couple of things going. Anybody interested? We met with faculty, we met with students, and we kind of created it. And I thought, hey, I've got a great student who's an alum who's working on something, but there's a school up there. Maybe we can do something with that. And so, and I just, Stacy and Alessandra were a dream to work with. I have to say that about both of them. They're just hardworking, wonderful students who were very committed to doing good work. Really good work for the community. So I was lucky they make me look good. They just are doing all this great work. And so hopefully we're hoping that they're going to do some presentations at, some other upcoming meetings. We're going to hopefully publish the process of it. We've been testing the TEL 1 model. I just think that sort of has hit a button with communities that initially when I talked to the staff at the Wiley Center, they were like, oh, these families have so much. Now we're going to go pile on, hey, you're not ready for an emergency, and get everybody all worked up. But it was the parents who came to me at the end saying, wow, I'm so fired up. This is so exciting. I can do this. And Regina, did you have your hand up?
I did. If I understood correctly, you're the founder of the TEL 1 model.
I am.
Is there some place or some resource where I can find out more information about it? I just think that's just a wonderful concept. So I just wonder if you had some literature out there that I could maybe review, or some other resource that I could find out more information about that model.
Sure. We just published something. I can send it to you. And Bailey, I'll actually, Diane is also one of the co-authors on that. So why don't we post maybe that article, Diane, that we started with the pilot, 20 families. We were looking at it in the context of the Sendai framework. What did the United Nations say we're going to be doing? How did we do this intervention? In a small sample, just to kind of test it. And just in those 20 families, when we did the follow-up, 16 of them had used the TEL 1. Like, that's for a first time, we were like, wow. And they were telling us, oh, this is great. And then they started talking with their family members, and it couldn't be anybody, just, so we actually brought them together. Thank you, Diane, for the community, grant that gave us the money. We would give them, basically, if they attended, they got an emergency kit. They were given, materials from similar to what Alessandra did. We put together, a lot of materials that they would, and then we gave them extra. And then the only thing I had to do is share them. And then they came back and said, hey, did you see? And they could come, if COVID hadn't hit, we wanted everybody to come back, including the people they shared it with. And we were going to create a prep party where they were going to put kits together and, say, okay, I went to this one place, Costco, and I got the water and somebody else got first aid kits, or, kind of put it together. It was like, it was fresh in our mind about knowing your neighbors, when we asked the families, hey, what if somebody's aunt who lives in the upstairs apartment, what if you couldn't find them? Would anybody know when the community gathered, like somebody was missing? And a lot of people were saying, gosh, I don't think I know my neighbors. I don't know who lives on the other side of me. This isn't just that community. Unfortunately, we might all answer a similar way with somebody who lives down the street or something. And so that idea, our next step is starting it with the community center, starting it as a model, but then bringing it into neighborhoods, so that when somebody is missing or they're not there, that we are going to look for them in a helping way. I think at Katrina, there were so many instances of, like, people are like out on their lawns with a shotgun. They're so afraid of their neighbors coming to their house, right? We want the opposite of that. We're in this together. I know you, you're my friend. Do you have water? What have we got? Do you have your kids? Just that idea of calling 911, which is important in an emergency, is not sufficient in terms of our preparedness. And the other thing was asking the community, what is their idea of an emergency? Because the families with children with special healthcare needs said, you know, poisoning. We've called the poison center a couple of times. We said, okay, that's an emergency, right? That's what your community needs. So part of what we supplied was magnets to put on the refrigerator, stickers to put on their phones so they could call. You know, again, it's about equity, right? Availability, accessibility, equity to people that they actually get this, and then empowerment that they can help themselves. And so we can disseminate that. And we do have, you know, it's some more grant things. We're kind of trying to expand this because I think helping people help themselves is just a respectful thing to do. You know, it's not that we're going to swoop in and you don't know what to do. That's kind of disrespectful to a community. This is given the right information, people are smart and can band together and do the right thing. You know, we have a sort of an underlying belief in that, I think, our group. So Regina, we're happy to include you and Bailey, and, you know, as we grow with these ideas, we're happy to include anybody who wants to be involved in this. The more the merrier, I guess, is what we'd say.
Wonderful. Thank you. I would love to be a part of it. Thank you.
And so we have run, I just want to quickly ask before we end, because I don't want to keep anybody, I know time is precious. Dr. Burch, do you see places where nurses could be involved in this? I think when you've come before, we've had ideas of including some of this with the public health clinicals.
Sure. Yeah, I think it makes sense. I'm sorry it was late. We had a meeting with our tenured faculty about our chair search, so I had to be there. But yeah, I think there's certainly, whether or not it's part of the community course, it could be, depending on what comes up, it could be another course. If you're dealing with aged faculty, it may extend beyond the community course. And definitely anything that there's an opportunity for volunteerism through the student clubs.
Right. That's another thing. There's a lot of student organizations on campus. And I also would love to see every opportunity every engagement that we have with the community. When a family goes home from the hospital with a new baby, they get a kit and some information, and then they share it. That idea of emergencies are not something that might happen. We've lived through them. We're going to live through them. No need to panic, just prepare. And it covers social determinants. It covers so much of public health and nursing and business and marketing. Like if you have a business, you have to have an emergency plan for people. So that idea of what we know we have to have and what we actually have, I think we've found some problems with that. Anyway, any final words, Diane? I think, thank you so much for this engaged discussion, and thank you, Diane, for giving us this opportunity. It's just been such a pleasure to work with everybody and to meet everybody here.
I agree. Thank you very much for attending today. Thank you, Teresa, and all of our presenters. Really appreciate your time and energy, and we will follow up with you, and let's keep this conversation going. We did record this, so if you missed a bit of it, or if you'd like to share it with someone else, we'll definitely send that out to you so it's available. Thank you all very much.
Also for
so
setting
much.
this up for us too. Bye, everybody.
Bye-bye.
Have a good day. Bye.
Bye-bye. Thank you.